Andy Strong here from Fundamentally Fit for all of your health, fitness and dietary needs. Now today we're going to be talking about digestive health. More specifically, we're going to be talking about the differences between gluten intolerance and celiac disease. This remains to be an area where many people get confused just as to what gluten intolerance is. Do they need to cut it out? And actually many still don't really know what or how serious celiac disease actually is. So before we can answer the differences between the two, we need to understand what gluten actually is. And gluten is a protein that is found in rye, barley and wheat. And the gluten is found in any of the products that wheat, barley and rye is actually added to. So it makes up a lot of the foods that we eat. Now, anybody who suffers from one of these two conditions will struggle to digest gluten, and it can cause discomfort, it can cause bloating, nausea, diarrhea, and to different levels depending on how sensitive you are to it as an individual. Now, celiac disease has a few subtle yet very important differences. In a sufferer of celiac disease, it's what's known as an autoimmune condition, and basically what that means is when they eat gluten, the body will try to break it down and attack it because it believes it to be a foreign body. This causes damage to the gut wall, meaning that future absorption of nutrients can be dramatically reduced. A sufferer of gluten intolerance, or what's often now known as a non-celiac gluten sensitivity, does not have this autoimmune response where the gut wall is attacked and actually damaged. Now, it's important at this point in the video to say that the research and the studies into gluten intolerance itself are not conclusive and they're still in the early stages. Celiac disease, however, can be tested for with a blood test, and it is estimated that around 1% of the UK population suffers from this condition. So if you do think you have it, head to your doctor or head to celiac.org.uk. There's some really good resources there, questionnaires, but I do recommend you go and see your doctor. Now in part 2, we're going to be discussing how you can actually treat and actually live with these conditions and how we move forward, and also how you can start to diagnose and some of the steps you can take to establish if you do have a gluten intolerance. Until next time, I'm Andy Strong, helping you to eat smart, train smart, stay fundamentally fit. I look forward to seeing you in part 2.